A drug is a medicine or other substance which has physiological effect when ingested or otherwise introduced into the body. There are 6 different types of drugs that, if used improperly, can have negative consequences on the body. Drugs can be broken down into 6 main groups: central nervous system stimulants, depressants, opioids, marijuana, inhalants, and hallucinogens. Central nervous system stimulants are a loosely defined group of drugs that tend to increase behavioral alertness, agitation, or excitement. Examples of central nervous system stimulants are amphetamines such as diet pills and Ritalin, cocaine, and caffeine. Typical signs and symptoms of stimulant use include excessive or unusual cheerfulness, frequent urination, difficulty sleeping, and a loss of appetite. Withdrawal symptoms from drugs can include depression, drowsiness, weakness, apathy, and hunger.
Central nervous system stimulants are extremely useful in the treatment of certain medical conditions, such as ADHD. However, the side effects and properties of these drugs make them attractive to recreational drug users. These drugs come with a high risk of addiction and, if abused, can destroy a person's mental and physical health. Cocaine is the most powerful and one of the most commonly abused central nervous stimulants. Once in a person's system, it increases alertness, induces feelings of euphoria, as well as confidence and sexuality. Sudden cardiac death becomes a large risk if high doses of cocaine enter the system in a short amount of time. Whether or not a person is a frequent cocaine user, that person can begin experiencing the consequences of using such a dangerous drug after the first use. Such effects include problems with the heart, brain, lungs, and respiratory system, gastrointestinal tract, and kidneys.
Depressants are drugs that lower neurotransmission levels, which depress or reduce arousal or stimulation in various areas of the brain. Sometimes referred to as downers, depressants are available in liquid form and pill form. Some of the most commonly known forms of depressants are alcohol, tranquilizers, and benzodiazepines. Benzodiazepines are useful in treating anxiety, insomnia, agitation, seizures, and muscle spasms. Depressants develop a tolerance at a rapid speed. To reach the same level of highness, a user would have to raise the doses needed to achieve the same effect. This may result in a coma or death by overdose. Withdrawal symptoms of depressants include insomnia, weakness, or nausea. Depressants can also increase the risk of high blood sugar, diabetes, and weight gain. Opioids are a group of naturally, partially synthetic, or synthetic drugs derived from the poppy plant or chemically synthesized in a laboratory setting. These class of drugs include both legal and illegal drugs. Legally prescribed opioids include morphine, codeine, and oxycodone. Illegal opioids include heroin. Opioids are used to help individuals cope with pain. They bind to natural opioid receptors in the brain, mimicking specific chemicals that are related to the sensations of pain relief, pleasure, and reward. However, since opioids have both pain-relieving properties and positive psychological properties, they are among the most abused type of substances currently available. Marijuana refers to the dried leaves, flowers, stems, and seeds from the hemp plant Cannabis sativa, which contains the psychoactive chemical THC. Marijuana is the most common illicit drug used in the United States. It has been legalized for recreational use by 2 states, and 21 states have legalized it for medical purposes. Marijuana is typically smoked in the form of a joint or in a bong. It can also be mixed in food or brewed in tea.
When marijuana is smoked, THC rapidly passes from the lungs into the bloodstream, which carries the chemical to the brain and other organs throughout the body. The effect of it includes altered perceptions and mood, impaired coordination, difficulty with thinking and problem solving, and disrupted learning and memory. Marijuana also affects brain development, and when young people use it heavily, it affects on thinking and memory may last a long time or may be permanent. Marijuana also has effects on the lungs and heart. Users may experience symptoms such as daily cough and phlegm production, more frequent acute chest illnesses, and a heightened risk of lung infections and heart attacks. Contrary to popular belief, it is addictive. Long-term marijuana users trying to quit report withdrawal symptoms including irritability, sleeplessness, decreased appetite, anxiety, and drug craving, all of which can make it difficult to abstain.
Inhalants are volatile substances that produce chemical vapors that can be inhaled to induce a psychoactive or mind-altering effect. Inhalants fall into several major groups: volatile solvents, which are found in products such as paint thinner, glue, and gasoline; aerosols, which are sprays that contain propellants and solvents; nitrates, such as butyl nitrate and amyl nitrate; anesthetics, which include nitrous oxide or laughing gas. Inhalants are easy to obtain. They are present in a variety of seemingly harmless products. Most inhalants are inexpensive and legal, so that makes them easier to obtain than any other drug. Users get high by sniffing, snorting, bagging, or huffing. Some common inhalants are household products, sprays, glues, paint thinners, and petroleum products. When using inhalants, most experience short-term effects like slurred speech, loss of motor coordination, and loss of consciousness. Inhaling high concentrations of any inhalant can lead to death due to suffocation. Possible effects of using inhalants include damage to the nervous system and hearing loss. There is also a high risk of cancer and damage to the liver, kidneys, and bone marrow. A hallucinogen is simply defined as a drug that causes hallucinations. Hallucinations include things such as images, sounds, and sensations that aren't really there. Hallucinogens also can cause major mood swings that are intense and immediate. Some examples of hallucinogens are mescaline, PSP, and LSD. Hallucinogens mainly cause damage to the mind and alter perception of reality, but they can cause damage to the body as well. These physiological symptoms include increased heart rate, vomiting, pupil dilation, increased sensitivity to pain, and changes in blood pressure. At high doses, the drugs may even induce convulsions and seizures.
Hallucinogens have been experimented before to be used as medicine for those who need to be relaxed or brought down. However, the drug's effects couldn't be controlled and had reverse effects at times, putting the patient into a state of panic. In modern medicine, hallucinogens are not prescribed. On the street, the drug is recreational and bought illegally.